In China, a mystery disease is spreading. It's infecting children's lungs. We've been hearing horror stories for quite some time now. Stories of hospitals being overwhelmed, classes being called off, parents lining up in hospital halls. Is there a new outbreak that China is trying to hide, a new virus that you and I should be worried about? And God knows, this is really creating fears of deja vu that are ringing some very, very uncomfortable bells for all of us. What do all of us have to do to stay safe? Now, let's start by taking a look at the facts. Children in China are coming down with respiratory illness. They have fever, their lungs are getting infected, there's inflammation. And from the capital, Beijing, to Xi'an, it's the same story everywhere. China's National Health Commission held a press conference. It admitted to a sudden increase in respiratory diseases, but it tried playing down the situation. China said the cases indicate nothing but a seasonal surge. In other words, children and people in general fall sick during the winters, and this is nothing different. Now, how much does this logic stand? Well, have you heard of ProMed? It is an international disease surveillance platform. In 2019, right before COVID-19 jumped borders, ProMed had raised questions about an unknown virus in China. Well, ProMed has once again issued an alert over the mysterious pneumonia in China. And here's something else you may want to keep in mind. COVID too began as a mysterious pneumonia. Quick question. What is the World Health Organization doing right now? Well, it held a joint press briefing with Chinese authorities. The WHO said it has received data from China. And this data indicates two things. One, there has been an increase in outpatient consultation. And two, there has been an increase in the hospitalization of children. Now, I'm not saying that the WHO is right, and let's hope they're right, and let's hope what the Chinese authorities are saying is also correct. But obviously the reason why the rest of the world is looking at this with some concern is we know when the last time all of these things started to happen and the Chinese authorities said there's nothing unusual, and the WHO says we are believing what the Chinese authorities are saying, that there is nothing unusual. The result was COVID. So the rest of the world has some reason to be nervous and worried. I'm not saying you should panic just yet because, as I said, the WHO could be right and the Chinese authorities could be right. But do keep an eye on the situation, because some people are asking the question, can a seasonal surge really flood hospitals the way it seems to be happening in China right now? Look at this sign at a Beijing hospital. It reads, please have one parent accompany the child into consulting areas. In other words, there's simply no space for an additional person, only one parent. Here are visuals from one of Beijing's children's hospitals. The traffic is busier than normal by far. You can see parents rushing in their children. The hallways are packed. Now, nothing about these images points at normalcy. And to be fair, it's not that the Chinese are saying that it is normal, but they're saying it is a surge and a seasonal surge. But clearly, parents are extremely worried.
My child's test results show positive in both Mycoplasma pneumonia and influenza A. I think her condition is quite complicated. Her dad had been lining up in the hospital for test results. After getting test results, he told me there are still 200 more patients before us.
Now, whatever this infection is, what are the chances it too will jump borders? Could it affect other countries? Now, if I were to answer this question, I'd say you have to assume that the chances are high and take suitable precautions, because every minute there are flights going in and coming out of China. We are currently in holiday season. Tourists from China are traveling around the world. Tourists from around the world are traveling to China. This is what happens. What's more, Beijing is counting on tourist dollars this year. The citizens of France, of Germany, Italy, Malaysia, the Netherlands have all been allowed to travel to China visa-free. Now, clearly, we don't want to be alarmist. This could be just, as China is saying, a normal infection, no novel pathogen, and therefore nothing really to be worried about. But let's face it, the probability is high that this infection has already traveled out of China. Just look at the Netherlands. There too, cases of childhood pneumonia are surging. Between November the 13th and November the 19th, there were 103 pneumonia cases for every 100,000 children aged 5 and 14 between them. The week before, the number was 83. Last year, during the peak of the flu season, Netherlands had just 58 cases of pneumonia for every 100,000 children. So the number's gone up. It's almost doubled as we speak. Now, what are we to make of this data? You could say, well, nothing unusual. This is a seasonal surge, and it's happening in the Netherlands as well. But clearly, there are reasons why people are nervous and why there is a heightened sense of alert. In India, 6 Indian states are on alert: Rajasthan, Karnataka, Gujarat, Haryana, Tamil Nadu, Maharashtra, and Uttarakhand. The last state is of special interest here. Uttarakhand has 3 districts that share a border with China: Chamoli, Uttarkashi, and Pithoragarh. Medical teams have been set up in Uttarakhand to monitor symptoms of pneumonia and influenza in children. In Rajasthan, rapid response teams are being formed. The state's health department has been asked to draw up an action plan, on how it plans to prevent the spread of infection and treat those who fall sick. In Puducherry also, people have been told to go back to wearing face masks in public. Now look, who are most at risk? Well, clearly it is children right now. Most of them are not vaccinated against COVID-19 either. They are young, their immune system is weaker. So if you are a parent to a young child, do look out for these symptoms: fever, chills, loss of appetite, nausea, sneezing, and dry cough. Now, I know those are very, very common symptoms. Children get those symptoms all the time. So to say look out for them, I know it's not being terribly helpful, but do keep an eye out for those symptoms. Talk to doctors and take whatever precautions are needed to stay safe from this mysterious infection. Don't panic, not yet, because let's keep in mind what the Chinese are saying and what the WHO is saying right now. There's no reason right now to believe you need to panic, but do be watchful.